The state of the world weighs on us all, from witnessing crime in our communities.
An investigation into the shooting death of a woman on the city green has now stretched past 24 hours.
To violence around the world. It weighs on us emotionally, but for young people, that weight could be amplified with additional stresses like school, parents, navigating relationships, and self-discovery. The medical director of psychiatric emergencies at Yale New Haven Children's Hospital, Dr. Claudia Moreno, explains minorities face additional challenges, leading to more moments of crisis.
When they face discrimination or racial profiling or have witnessed community violence and have seen how maybe the police has interacted, even with the media, right? With George Floyd and all that. So there are times when I've seen, big mistrust for agencies such as the police or the Department of Children and Families. And so such mistrust has led to delays in care, meaning the parent is like, I know my child needs help, but I also don't want to get in trouble and I don't want to lose them.
Stigma may also play a major factor.
Like there's tons of myths about mental health, right? I know in the Hispanic community, which I can speak for, there's this thought, if you say you have mental illness, then that means that you have, a deficit in your character, something's wrong with you, you might not be able to be successful in life.
Thankfully, there are signs that parents can spot to indicate something may be going on.
When they're sort of cutting out all kinds of relationships in the community and there's that isolation, that's concerning. When there's changes in sleep or appetite, or when a parent has noticed that their child is self-medicating with substances or with alcohol, when they're giving away their things or they're voicing suicidal ideation, we know that things are pretty bad.
When those signs appear, it's parents who can make a world of difference.
What's going on with you? You used to have all A's in school and now you're failing, right? And it's coming from a place of good intentions. The parent is concerned about their child, but the way, if this child is already kind of broaching depression and they hear their parents saying those things, they're not hearing mom and dad are concerned. They're hearing, I'm a disappointment, I'm failing them. And it could add insult to injury, right?
But the key is to get your kids talking about their mental health.
Coming from a place of more curiosity, of like, I notice this is going on. Can we talk more about it? Or if you don't want to talk to me, that's fine. But who are you going to talk about it with, right? That I can check on afterwards. Like, is it your pastor? Is it your pediatrician? Is it your school counselor? Is it your coach? I don't care, but we need to talk about these things with someone.
Jake Garcia, Fox 61, Connecticut's news station.